lishonile malanye namahle lishonile benkosi lenhle singena ke ehlelweni lethu nalomhla inzambama kumsakato yeSwatini TV. Lo hlelo lolu ulithola ngekuthi sibambisane futhi nemsakato ichannel yeMaswati, nakhona ke sitawutholakala ke ku ichannel yeMaswati khona ke lomhla ebusuku. Luhlelo lolu lohlohlose ke ukuthi litawukhulumisa tindzaba the COVID-19 coronavirus le seyisishito njengoba sishito itolo ukuthi ngumkhuhlane lo lesewuhlasele umhlaba wonke. Ngwanelo muhle ehlala nami ke na imzuzu lengamashumi lasihlanu sikhulumisa yona indzaba libitho ngibonga kwamathebula. Lo mhla ehlelweni sitabe sikhulumisa nje ekakhulu tindzaba te mithi noma ke letiqhamuka kuto tati te mithi netempilo. Sinaye la Dr. Kevin Makatsange lo ngumthuthukisi wetempilo, aphinze futhi abuye abe nguloto lo sebenza kuvikela kwanza kwetifo khona ke elihhovisi lala eSwatini. Ukhona ke sitawukhulumisana naye ngetintfo letinyenti kakhulu kubuka ukuthi ingabe inzima ledlalwa ngu-World Health Organization ekulweni nawo lo mkhuhlane itsini futhi inganani. Asihlale kanye ke embukeli lapho ekhaya, nawe ke nawungathanza ukuthi ube ingcenye yalo hlelo ungasithumelela leyo mleto kuma social media pages ethu sisachubeka nalo hlelo. Konke leni kukhuluma kona leni kubutako sitawenda siqiniseke ukuthi siyasukuma siyahamba siyofuna imphendvulo ngoba lo hlelo ngelwenu luhlose ukuthi litawusita eMaswati ukuthi sibambe nomkhuhlane unganzi. Kodwa ke singatha ukuthi kathe asesiye lapha ke kuyinsatheli yethu yemsakato LinkedIn Gule abelapha eParliament asilethele ukuthi ingabeke
endlini lachaza ukuthi selutholile umbiko ukuthi kukhona lilunga leselinawo lo mkhuhlane weCovid-19. Nembala ke umqondisi wezinkulumo uvetile ukuthi induna yetempilo lizinkosi ivele ke inalo libandla leselilungisile ukuthi litavele liwahloleke emalunga eParliament ukuthi khona intimpawu dawo lo mkhuhlane leku exercise lesevele ke iqalile kwendiwa
lobe bese uyagula lethwe khona bamkhanza ukuthi unayo lo COVID-19 wase uthumela eParliament wathi akubikwe lokuthi yena usona COVID-19 ucela ema-parliamentarians atest ngoba kulamalanga laphelile ngaphambi usangene lesibhedlela bekasebenza nalabanengi babo wahlangana nabo labanye wahlangana nabo ngiyacabanga na socially so wabika kulomunye umhlonishwa wakalobamba lomdzala wase ke naka announce salungisa ke silidika ukuthi cha bahlola namuhla ingako lokunibabona nje iParliament kase bacedzile kodwa bamele lokutest so bayatesta lamuhla.
Sizeni event minister nikhuluma ngabo contact tracing singanigadza yini ukuthi kuye ngale miphumela ukuthi thini ukuthi ngendeka nini nasemindenini emalunga
kunjalo i-contact tracing msakati isho ukuthi loyo naloyo lotsinzene nalolo sa-positive kufuna hamba yohlolwa ukuthi yena unjani. Kusho sitangachamuka lomnye lo positive lapha lamuhla utawufuna sibahambe bahlole bonke, kuhlola umndeni wakhe kuhlole nalabanye lekatsinzene nabo njengoba nje lo mhlonishwa lo announcele ukuthi yena so positive. I-team itawuhlola umndeni wakhe ihlole nalaba lebasitsinzene naye.
Siyabonga kakhulu minister.
Siyabonga.
Kunjalo bongosi sethemba ukuthi nembala njengoba ichaza indvuna kutaqhubeka umsebenzi wako kuhlola kwawo emalunga sekuyathandazwe ukuthi kube bede linye ilunga litfolakala ukuthi linawo lo mkhuhlane weCovid-19 ngingi-LinkedIn Gule ngilapha eParliament.
Insatheli yethu ke LinkedIn Gule useParliament lapho bekasibikela khona ukuthi kusachubeka yona ke umsebenzi wemalunga eParliament lomhla kobese ke kufika wona umlayeto lapho ilunga lakalobamba lomdzala liphakame ngayo ke standing order 58 loku standing order lovumela ukuthi ilunga lingaphakama ngendzaba lephuthumako kubese ke kulandzela ke wona umsebenzi ukuthi kuhlolwe wona ke malunga eParliament. Kanzi sikathile ukuthi lapha ke insatheli yethu LinkedIn Gule lapha etindlini noma emahofisini etindvuna tembuso lapho ke ahlangene khona nendvuna yetiko lengeni Dr. And to kick start our what is your role as World Health Organization within the response to COVID-19 as the world is still battling how to deal with this pandemic?
As the viewers might be aware, WHO is the lead agency in health matters within the United Nations, in all health issues, which include this pandemic that we have, because it's a health issue. So we are working with governments to regional level and even at global level. It has got 8 pillars, and we work with countries under those 8 pillars, which covers the issue of coordinating the response at country level, from higher authorities even down, actually very key and crucial to the response. So we support countries to strengthen the laboratories or the testing capacities. Then the other one is on case management, which is the treatment itself of the cases, those that test positive, which involves the issue of setting up treatment centers, building capacity for the health workers, that's training our nurses, our doctors, and even the support staff. And then the fourth one is actually on surveillance. And surveillance, that's where the intelligence of the response, so that we find where the virus is, who are the people that are affected, and then that will inform the response. And also that's what brings the issue of what is called contact tracing, case investigation, the rapid response teams. I think people on the field, they actually know about these teams that are out there looking for the cases and actually finding them, isolating them, and treating them properly. Then the fifth one is on risk communication and community engagement, which is where we raise awareness, because responding to an outbreak involves behavior. It involves working with the people, and the people are the ones that are actually in the forefront of the risk prevention and control, or IPC, which is now where we work towards reducing the spread of the infection. And that's where we talk about the issue of the PPE, the personal protective equipment, which is given to the health workers to protect themselves. And then we talk about the issue of masks, we talk about the issues of social distancing, we talk about the issues of hand washing. Those are all issues to do with the IPC. And then the other one is port health, because COVID, when it started there in China, and then it was crossing borders and moving. And actually, in countries, the introduction of COVID was through travelers, people who came from where it is and bring it. So port health is one of the pillars where we actually support countries to do screenings at the borders and actually follow up travelers, so that we actually limit the spread. And then the other one, which is the last one, I think, is actually covering logistics, supply chain, and resource mobilization, which is also a pillar. So we provide technical support to government to come up with plans that cover all these pillars, and then implement those plans. And if that one is done, it can actually lead to actually dealing with the pandemic.
Dr. Makatsange, have we implemented each of these 8 pillars, and how do you find the response from government as WHO?
Yes, the implementation, because the country has got what is called the National COVID-19 Preparedness and Response Plan, which was developed with support from WHO, and that plan covers all those pillars. And you can actually, the Lubombo Referral Hospital, that's part of the strategies that were actually identified. If we look at infection prevention and control, a lot of capacity building is actually happening. Health workers trained so that they actually protect themselves. If we look at risk communication, there's a lot of engagement that is going on through the media, through interpersonal communication, through even influential members of the society. They're actually engaging people. Laboratory strengthening, we can actually say at the moment, as a country, Eswatini has got testing capacity, in-country testing capacity, which is actually a big achievement, because when this started, we could only send our specimen to NICD in South Africa. But now, with the establishment of the testing capacity, we can actually scale up our testing, and many people can actually benefit from it. So I can say Eswatini is just focus even
on risk community and engagements, which for me I think is critical to and with COVID-19. How has this received by emotions and everything that to them?
community and crucial to any outbreak risk. Because, as I said earlier, the are actually individuals. You as an individual empowered to know that you have the power to turn the curve, or actually to stop transmission through the risk communication. Change, so we should change, and what we actually and other partners are saying, try to abide because stopping the outbreak starts with me or you as an individual. And we need to know that if you are to experience zero COVID-19 cases, it starts with you. The Minister of Health and the people can come to engage, but you as an individual, when you are not really convinced that you need to do something, then that's where the problem is. But we need to be convinced that we need to do something at individual basis to stop the spread of coronavirus.
What have you found to be a major challenge for people to accept or behavior, or to adopt new behavior patterns and do away with the old habits?
With the behavior change actually it's something that is very difficult and complicated, and it takes time, because you are trying to get someone to do something that is not used to doing. So it takes time to convince people to change behavior, and that is something that is recognized, something that is actually known. But what we know is with persistent engagement, people can actually end up adopting the behaviors that will help to prevent the disease. You know, at times coronavirus, and we need to get that in our minds that we need to do something. So denial is one of the things. Then the other things is the issue of misinformation, when people are actually spreading a lot of misinformation, which will lead people not to take the necessary behaviors that are supposed to be done. But it takes time to change behavior, and in some incidents it takes even drastic things to happen before someone can change. If you see your neighbor dying from coronavirus, then that's what can actually push someone to change behavior. But we don't want it to get to there. Let us believe what is being said and use it actually to convince ourselves to change behavior.
But do you change the strategy if you try one, it fails? Do you try another one in engaging the communities?
Yes, with the risk communication and community engagement, there are actually strategies that are used. There is one which is called precautionary advocacy. That is when people are not really doing what you want to do when there is a threat that is threatening them. Then you at times try to frighten them a bit so that they change behavior.
Okay.
And then there's so there are a lot of actually strategies that are actually used to engage people. So our risk communication and community engagement that we are using, and what we actually provide support to the country, we base on those known strategies that we use. Like at the moment, we are actually doing what is called crisis communication.
Okay.
Because we're in a crisis. The threat is very high, and people are very afraid and whatever. So use what is called crisis communication.
Are they responding to that?
Yeah, I can say yes. But to actually see, we have just, with support from UNICEF and the WHO, we have just completed what is called a knowledge, attitude and practice survey, of which the results have actually come out this week. Okay. We'll look at them and then we'll see if our interventions that the interventions that the country has been doing, okay, we're actually having impact.
This now brings me to the next question, the area epidemiology, which is an important area within the prevention of disease escalating into a pandemic. Mm-hmm. Have you as WHO done enough in that regard with research, with providing data, which will help African countries to adopt and then implement?
Okay, yeah, one of the key focus areas for WHO is generating evidence and communicating that evidence with people timely. And actually, since this is a new event that is happening, there are lessons that are learned from where it started, which is in Wuhan, in China. Actually, WHO had a mission that went there to document everything. Mm-hmm. And that evidence is actually shared with other countries. Mm-hmm. And countries are actually encouraged to use the lessons learned in Wuhan, mm-hmm, to structure their response. There are also lessons learned in what happened in Europe or what is happening in Europe. That evidence is documented and is shared with member states to use it actually to structure their response. Mm-hmm. And then countries in Africa as well, they are encouraged to document and do research and generate evidence that will also be fed actually to inform even future response that will be happening. So as WHO, yes, there is ongoing research. Okay. I can't say we have done enough, but we are still generating the evidence through research, working with member states, working with academia, working with different researchers. And then when the evidence is there, that's what WHO will use now to give recommendation. Okay. Recommendation based on...
Let's take a break, Dr. Makatsanga. We'll come back to the epidemiology, and of course we'll be focusing more on research and how as a country we have done in that regard. Babukele makhaya sikhulumela na Dr. Makatsanga sikhulumisa nje lo muhla tindzaba leti qhamuka kubo bochwephesha ngoba ngibo labahamba empili lekumele ukuthi sibalalele ngaso sonke isikhathi. Uyadideka Dr. Makatsanga ukuthi silive senta njani kuleti insika leti siphohlongo stipulate aphakanyiswa ngu-World Health Organization ukuthi emave emhlaba atilandzele lesigcile kuyo ke indzaba kunayeka risk communication ku community engagement. Sibuka ukuthi basaphuma baya khona ke emangweni bayofundzisa ingabe bantu khona emangweni bayithatha indzaba uyasho ukuthi kunyeni lokwentekako bathi bona tinkinga letiqhamuka lapha nalapha kodwa ke basachubeka nekufundzisa. Uyasho ukuthi futhi WHO bayaveta kuhulumende ukuthi abathathe tifundo leti sifundzela lapho liqale khona lo mkhuhlane i-coronavirus sitifake even kuze ukuthi sitawukhona ukuthi silincobe ngoba bona sebakubone kucala thina sesingakuthatha ngalana sikufake sikusebenzise sibone ukuthi siphuma nani. Ngishito ngathi insatheli yethu yemsakato LinkedIn Gule ilapha emahhovisi ethu Ntuna Tembuso kulapho ke isithethela khona umbiko ukuthi ingabe sihamba njani silive tiyenyuka noma tiyehla LinkedIn Gule usilungisela umbiko lapho khona ke bekune press conference lebendwe induna yelitiko letempilo Lizinkosi.
Lamuhla ema results lesinawo labuya ku COVID-19 testing eme kanjena. Sisesema test laphumile abangu 72. Kulama test lang 72 sikhanze ukuthi langu 7 are positive. Siyacala ke nebekunene ukuthi kube khona ilanga linye sibe nema cases lamaningi kangaka la positive. Lokho kusho ukuthi solo sacala ku testa kuze kube ngilamuhla dinombolo tethu dalaba positive setting 31. Siyachubeka negaya ema test nebekunene. Kulaba labavele lamhla beme kanjena. Case number 25. Ngubabe loneminyaka lengu-51 usuka kuManzini region. Uchamuke nemkhuhlane lobukeka ngathi umelula nje. Bekasesibhedlela lesi-private khona lapha eVen. Abeteke i-history yokuhamba nekuthini lekusho ukuthi uyithole khona la ngekhathi eVen. Case number 26. Uneminyaka lengu-29 ngubabe uhlala kaHhohho yena i-region. Naye uchamuke nemkhuhlane lomelula naye ude i-history of travel. Case number 27. Una 28 naye ngubabe wakaHhohho region. Naye umkhuhlane wakhe uselula kodwa ke yena ube ne-contact nalomunye lobe case number 17 kulale lesibamemetele ngempilo. Case number 28. Ngumake loneminyaka lengu-27.
Tindzaba letichamuka ke khona ke emahhovisi etindvuna tembuso kulapho ke induna yelitiko letemphilo besetholela khona ke umbiko ukuthi sesinalabanye labasikhombisa labangetekako. Dr. Makatsange, should this be cause for concern? The numbers are rising.
Definitely this is a cause for concern. The numbers are rising, but in any outbreak, this I can say might be expected.
Okay.
Yes, the cases will rise until you reach a peak and then you start actually going down. This is expected, but it calls for us to sort of up our game in terms of prevention.
Okay.
Because we need to stick to the recommended interventions for preventing the infection. And as I said earlier, zero coronavirus starts with you. And if we actually do what is recommended, because the best way to protect yourself is frequent hand washing with soap and water. And if you have the sanitizer, use the sanitizer as well. Then the other one is actually social distancing. You try to avoid being close to someone with flu-like symptoms. Someone who is coughing, someone who is with a fever. You maintain a distance, at least 1 meter distance away from the person. That's social distancing. Then the other one is actually the cough hygiene. When you cough on a tissue, you throw it away, or you cough into your flexed elbow and you wash your hands. And if you have any flu-like illnesses or flu-like symptoms, you go to the hospital or health facility as soon as possible so that you actually detected early before you spread it to other people. So we need to actually stick to all those interventions that are in place so that we prevent this outbreak actually getting worse.
I'm picking a few cases of elderly people who are contracting coronavirus. Is there any relation between age and COVID-19?
In terms of actually getting it, anyone is we are actually at risk, same risk of getting it. Then the difference will come in the severity.
Okay.
If you get it when you are young and healthy, you tend to develop a mild form of the infection. At times it can actually just come as a mild blocked nose and it can actually go away without you noticing it. But now if it gets to people who are a bit advanced in age, the elderly, that's where it tends to be severe, and those people who tend to develop severe infection. So elderly is someone maybe 50, 60, going up. And also the other thing is those who are advanced in age, they tend to have other diseases with them, diabetes, high blood pressure, some will have cancers.
Okay.
All those people are actually at risk of getting severe infection. Then if you are young, what can actually also give you a bit of a higher risk is if you are a smoker, if you are someone who smokes. Because smoking actually causes a bit of damage to the lungs. And this also virus works on the lungs. So those people are also at a bit of a risk. Then in terms of HIV, TB, at the moment there is no evidence. We don't know the link between coronavirus and the outcome for HIV and TB, because all along it was affecting people in Europe and whatever. But now, as it's coming to Africa, we need to actually collect that evidence and actually come up with
We'll get to that part, Dr. Makatsanga. I want us to focus on self-prescription.
Yes.
Old habits die hard, Doctor. I think you know that. You're an African.
Yes.
I'm an African. I would want to try a few remedies here. Can I self-prescribe?
With the coronavirus, the advice that is coming from WHO is try by all means to avoid self-medication. If you have got flu-like symptoms, you are coughing, you are having difficulties in breathing, raised temperature, go to the hospital as soon as possible. Because these are the medicines that we use or foods that we use for self-medication. There is no proof that they help to prevent.
Even, Doctor, I can't throw in a garlic, bit of ginger here and there?
Garlic, ginger, lemon, those are foods. They are food. And we should eat them as food. Yes, they might have some antibacterial properties here and there, but there is no evidence that they will help to treat or cure you if you get COVID.
Okay.
So eat them as food, but not to eat too much of it as a way of trying to prevent coronavirus. The best way to prevent coronavirus is washing your hands with soap and water. That's the best way to actually prevent it. And that's what we're actually recommending. So self-medication, no.
But there's a bit of, we are Africans, like I said, J's fluid, can I wash with that, maybe a bit of bleaching substances? Because I think, I may not have the money to get a sanitizer or a soap. Could I try a J's fluid, a bit of diesel here and there?
No, those are some of the things that people are trying. But what has been researched and what has been proven to work is washing your hands with soap and water. Not all these other things. And then if you use a sanitizer, you need to use a sanitizer that is alcohol based. The alcohol part of it helps to actually kill the virus that will be stuck to onto your hands. So any other sanitizers, if they don't contain the correct amount of alcohol, they are actually useless. Okay. So you would rather wash your hands with soap and water.
Okay, Doctor, let us demystify the issue with alcohol.
Alcohol.
Yeah. Let's focus on that because we are going to lose people there. Can I use my brandy to wash down COVID-19? Is there anything like that?
The answer is no. Drinking alcohol, brandy or whatever will not help you to flush or to prevent coronavirus. Actually, excessive consumption of alcohol is dangerous to you, might be dangerous to your health.
Okay.
So, if you take too much alcohol, it might lead actually to damaging your liver, lead to non-communicable diseases and everything. So actually, there's no evidence that taking brandy, whiskey or whatever will help to prevent or cure COVID. No. There's no evidence to that, and actually it might be dangerous.
Okay, thank you, Doctor. Let's pause for a moment. Babukele Makaya, sikhuluma indzaba lemcoka lana njengoba nimfa Dr. Makatsanga uthi ayikho indzaba ukuthi uthi nawuphakamisa libhodlela lakho lechwala uthi mfi itawube seyehla i-coronavirus nayo khona ayikho into lenjalo. Lokukhona lekumele sikulandzele ngilokubekwe inhlangano yetempilo kaMhlaba ngekubambisana nelitiko letempilo kanye nahulumende ukuthi asihambe ngendlela lebekiwe makuthiwa asigeze tandla ngemanti kanye nensipho silandzele lokho singabe sithi mina nginaye shibosh wami ngawubulala emagciwane esandleni noma ngidawuthi fafa lo diesel wami kancane itawufa siwasha sigeza tandla ngemanti nensipho njengoba ke ayibeka sitawukhulumisa nyalo indzaba yema underlying conditions njengoba ke wayithinza kodwa ke singayi kuyo sitawubuva naba belibandla leliphila nashukela sitawukhulumisana nanokuthula wakazwana sitshela ukuthi bona bayithatha kanjani indzaba ye coronavirus COVID-19.
Sine ke bantu bashukela. Uma sinalo shukela umtimba wethu emasotsha ayehla. Uma ungabuka nje ukuthi isifo sashukela senda lokudla kwakho lokudla kokuhambe kancane. So ngaleso sizathu leso thine siku risk lesetulu ukuthi na ubanjwa ngile COVID isheshe ikubulale. So sitawucela nyalo ukuthi njengoba umhlaba wonke uthi asinakekele ukuthi sigeze izandla. Noma ungatigeza ka30 ngelanga akunantsaba. Ungabambi itandla usanza chawula umuntu. Uthathe itandla ufake noma emlonyeni noma kuphi ukubalekele lokho ngoba akabonakala lo muntu lona le COVID. Njengoba sicoca nje ngento ekakuthingayo. Uzame nalokwa khweshelana nale distance ukuthi ningabi thutane. Lokunye lesikukhuthada ukuthi njengoba labanyenti labanashukela ngilala sebakhulile and siyathanda kufukama lisiko lethu kodwa ngenxa yalesimo lesi siyacela manje nihlale emakhaya uma kunesifo manuvele nje ngalelo langa ubalile lo ubuyele ekhaya ukuze ukuthi anciphe lamathuba ekuthwena uthole lo mkhuhlane omkhulu. Thine njengabantu bashukela lokuluhlata kukule lisiko lelivikela lo mtimba wethu. Ngiko sithide ngiko lesicela kube kunyenti khona le mtimba yethu itohlala inemasotsha lasigadzile nayithi yafika iCovid ikhanze emasotsha ethu asetulu ikhanze ishukela wethu asezingeni lelikahle. Phinze futhi nawubona ukuthi wena njengoba sihlede emakhaya phela njengoba kuthi phela si locked in uyalingeka kudla kaningi uvumelekile kudla kasithupha kodwa kulokudla kasithupha kwakho akusho ukuthi sekutaba lipalishi kuze liyoshona lelanga ngiyabekisa utawudla breakfast yakho bese kuthi emkhathini so ungathatha noma emabhontshisi akho noma etinkobe takho noma emandongomane uhlafuhlafune noma ifruit noma leyo salad yakho yelethisi.
Sibuya ke kuyo ke i-inserted lapho sikhulumisana khona nebelibandla le bantu abaphila ke nashukela uyayichaza ke emabhalweni wabo nokuthulazwana ukuthi bayiva kanjani bona lenzaba ye COVID-19 nekuthi bathinza kanjani. Dr. Makanza, let us talk now about the issue of underlying conditions. What is the relation between COVID-19 and underlying conditions? Is there any relation? And two, how do we deal with COVID-19 as people who are living with those conditions?
Yes, with the underlying conditions, actually what has been observed is that most of the people that end up actually dying, they've got underlying conditions, which include diabetes, sugar, heart conditions, and cancers, and others with lung conditions. So what we actually recommend is if you are one of the people who is suffering from those, you need to take extra precautions to protect yourselves. So those are some of the people who will recommend that if they are going out, they should wear masks to protect themselves from getting the infection. And they should try to avoid gatherings where there are a lot of people. And in the families, us other people who come from members of the family, we also need to take special care of those people. Let us not bring infection to them. If you feel that you might be infected, the best would be to try to avoid actually getting in contact with those members of the family that are actually at higher risk. So that's what actually we recommend. And if you have those underlying conditions and you have flu-like symptoms, the best would be to go to the hospital as soon as possible. And you also tell them about your underlying conditions.
Okay.
Because some will go there and then they will be treated for the coronavirus. Then they will be discovered that, they had diabetes. Later, when the diabetes is actually not under control, and that they will die out of the diabetes and not really out of the coronavirus. So that's what we actually advise.
To take extra care of themselves.
Yes.
And we also need to care for them.
We also need to care for them,
Okay.
yes.
Dr. Makatsange, let us come back to this serious assertion that is attributed to World Health Organization. You say that not you personally, but World Health Organization says that Africa is likely to be the next epicenter with a projected 300,000 deaths. That's catastrophic, Doctor. What do we need to do?
Yeah, because you see those projections, they come about, we do what are called scenarios, where you build scenarios, you put some assumptions, and then you actually see how the outbreak will be actually progressing. So with what is there, yes, we might experience, an outburst of cases if we don't put in place measures to contain it, which include what we have learned from what happened in the other countries, putting the lockdown measures in place in time, and also strengthening our health systems so that they'll be able to cope when these things actually come. But now that will actually bring us to the challenge that we have as Africa. We have lots of other underlying things that are destabilizing ourselves, and the issue of malnutrition. There's a lot of malnutrition that is going on. The issue of our sanitation, the issue of instability, people fighting each other, and all those things. So if this COVID happens to come and become an outburst, yes, we might face a real challenge. And though it might be something that is a bit tough to swallow, but we need to have that in mind. And it should help us to get ourselves to prepare. With what is happening, most of African countries, we are experiencing, low numbers and everything. This is giving us time to get ourselves prepared and ready. And if we don't use this, and if that other projected scenario comes in, really we'll be in trouble. We need actually to use lessons that we learned from what happened in West Africa for the Ebola. Or even what happened in Congo for the Ebola. We need to use those lessons to build our health systems, to get ourselves prepared, to put our coordination structures in place. And then if it comes, we'll be ready to respond. And it might not be as what is projected.
So the time to act is now, Doctor?
Yes.
Okay, Dr. Makatsange, thank you for your time. We really appreciated it. Babugele Makaya sikhuluma tona ke tindzaba te COVID-19 namhla ungathi lihlelo niyaluva nje ukuthi lungathi lishubile technically sikhulumisana netati kutempilo Dr. Kevin Makatsange lobuya ka World Health Organization lobe yasichazela nje njengoba basho ukuthi baphumile babambisene nahulumende yasetshenziswa indzaba ye COVID-19 etinkundleni emangweni sisebenzisa ke idemocracy yethu etinkundla levuma ukuthi sicale kubo baphathi betifundza siye kubo babetikhulu siye kumalunga eParliament siye kubo bandlancane singena nakubacocoteli iziyongena yenza ekhaya ngalinye nangalinye sitabe naleto sikhulumisa ngoba siyafuna nekuyova ukuthi ingabe boba betikhulu bona bayiva yini indzaba yayo i-coronavirus malanga lamahle sichubeka naloke luhlelo nyaloke sitawuva ukuthi ingabe bahlabeli bethu nabo labayisukumele etulu indzaba bayiva yini bona bathini futhi kubalandzeli babo asesive nangikhole shabalala.
Greetings everyone at home. My name is Kole. I'm your Afro Soul jazz singer, and I'm also part of the Eswatini music collaboration COVID-19. As an artist with all my music friends, we just wanted to send out a message of hope to say, please, let's listen to the authorities and the health workers when they tell us how to protect ourselves and save life.
The Minister of Home Affairs wishes His Majesty the King and Ingwenyama of the Kingdom of Eswatini a happy 52nd birthday. Bayethe wena waphakathi. Long live your Majesty. The citizens of Manzini, Honorable Mayor, Councillors, management and employees of the Municipal Council of Manzini takes this opportunity to extend their heartfelt congratulations to His Majesty King Mswati III on celebrating his 52nd birthday. Khula Mlisa.
Babukeli emakhaya sikulo luhlelo lwethu lapho sikhulumisa khona ke indzaba ya COVID-19 level sukumele tulu lilwa nayo ke indzaba uyasho Dr. Makatsange ukuthi asisukumeni kusikwende konke kumele sikwende nyalo njengoba uhulumende na tonke inhlangano labamsene nato basasishumayela nathi icala ngathi njengoba sishito itolo ukuthi siqhamuka tifundo emuva kubo HIV and AIDS lesicubulo nje lesihamba ngaso ukuthi icala ngawe lendzaba siyasasebenzela nasakhuluma indzaba te HIV and AIDS asisebenzise nathi semakhaya ukuthi icala ngawe konke kucala ngawe kude ukuthi ingahambi njengoba siyayisive ukuthi ayihambi i-COVID-19 noma i-coronavirus kuhamba abantu babese bahamba nayo ke bayithela labayithela khona asibambeni malanga lamahle tingenyuki inombolo njengoba sivile ukuthi namhla tenyukile sisakhuluma dona ke tindzaba te-coronavirus COVID-19 kuba kunyenti ukukhuluma lokuba khona ukhanze ukuthi sesigcina sikhuluma nemahemhem emanga sikhulumisa lendzaba kenyalo ukuthi siyekele lokuthi sihambe nje sishaya abantu ngemfiphinziwe sikhulume tintfo lekungito sithi thathi nasemthonjeni lengito ngobe ikakhulu noma uchubeka nako lokho kungenteka ugcine sewukhalela ubuza Nkosi akubi mnanzi ke ukuthi ungakhalwa ngebuza Nkosi ngendzaba nje ukuthi wena nje awukhona ukukhuluma indzaba lengiyo eceleni kwami nginalubambe kuba ngumhlelo noma ke kuba ngumhlelo wetindzaba ku ke umsakato Eswatini TV the acting editor in chief John Mleleke ngisitoyikhulumisa indzaba ye fake news asivele singene kuyo ilimatanga nani lendzaba ye fake news iyini futhi
angibongele lithuba Mkholo ngivusele nakumbukeli ekhaya umbuto wakho Mkholo ngicabanga ukuthi kuphendula nasikhuluma nge-fake news sikhuluma ngidawusho ukuthi ngetindzaba letigaywa ngenhloso yekucekela phasi kungaba kumbe i-agency kungaba umuntu nje ngidawusho ukuthi umuntu uphaca uthole ukuthi kususwa nje indzaba iyagaywa lendzaba lena ideliciniso ngawuthi kube besingakhuluma kumbe ngelimi layitolo la journalism Mkholo besitawuthi yellow journalism kuhanjiswa nje emanga mahemhem yi-grapevine but inhloso lenkulu kusuke kukulimata ngidawusho ukuthi loyo muntu ngeke ukuthi kuhanjiswe i-information lengasilo nani liciniso bese ke sikhuluma ukuthi ma fake news
singayibona ngani indzaba lengasiwe emanga nje kunoma lengathi lesingathi manga
kuyashiyana Mkholo ngidawuthini nasikhuluma kumbe ngekhanjiswa kwetindzaba siba nema platforms kune media lengathi kumbe i-traditional utaba ngithi sibe umsakado wetithombe kube kumbe maphephandzaba bese sekuba kumbe nangawo umsakado wemoya i-radio kube sekenyalo sekungena lenye ngidawusho ukuthi i-platform lapho khona sesikhuluma nge-social media Mkholo lapho utawubona ukuthi one kuba bede kumbe sikhathi noma ema processes lendiwako ingakakhishwa lendzaba njengoba ukuthi kutfolakale ngidawusho ukuthi inhlangothi totimbili noma kumbe kutfolwe emaqiniso ukuthi lendzaba vele ingiyo yini kusho ukuthi nje lenhloso njengalo ngisho Mkholo ukuthi yona ihlose ekucekela phasi kuvele nje kugaywe lamanga afidwe labantu lokho akuhlunge ukuthi la social media lengathi mina njalo kuba ukhuluma Mkholo nadokotela uthi kune epicenter kulamalanga nje i-epicenter yalama fake news ngile social media Mkholo
sitayikhulumisa Mleleke ukuthi tindzaba atipheli phela sona sikhathi sitayikhulumisa ngoba ingilenye lendela phasi umsebenzi lo wendiwa nguhulumende ukuthi athi uhulumende aphumile alwa nako kwenza kolomkhuhlane sibe sichamuka nemanga sikhuluma sesabisa abantu lokunye lokuvela ukuthi uma indzaba noma lo mletho uchamuka kubantu sewubonakala ulichungechunge chain messages uyabona ukuthi akusilo liqiniso kwachamuka umbiko lovela ungathi uyetfusa awusilo liqiniso kwachamuka umbiko lo ngeke ukhona ukuthi ungathi umthombo wawo ukuphi kuthiwe awusivile nje ngandlebenye ukuthi sekubhubhe abantu labangaka even leyo ndzaba isilo liqiniso lokubhlungu ke ukuthi kulama regulations ayoke i-COVID-19 lukhona liswati futhi akusilo liswati lolincane tiyabalwa tinhlangothi tize besihlanu ukuthi kumele ukuthi ungakwendi naku kuye section 25 kodwa ke sitayikhulumisa njengoba sihamba nawo ke emalangeni ukuthi sigcine siwekhutile lo moya ugcine uphelile simaswati asingavami ukuthi senze ngento lekungasiyo mana namahle silushaya silibeka lapho luhlelo lwethu lomuhla bongani mathelo ukuthi sitawudibana futhi kusasa sengicishe ngithi evileta kusasa ngaso sikhathi lesifana kanti ke nalapha ke ku umsakato ichannel yemaswati utasithola ke khona ke lo mhla entsambama kanti sitawuphinze futhi sivele kulo msakato lona seliphindwa luhlelo kusasa ekuseni bongani mathebula nalo lonke libandla bekasebenza nalo lo mhla ukuthi kubukela lokuhle enhlelweni letlatselako nisale ngahle.
Nine bekunene maswati lamahle igama lami ngumshikishi Mzebele umhlabeleli wembhacanga ngithanza ukuthi ngiqwayise emakhaya nilalele betempilo kulaba sitshela kona bekunene ngileli cembu nali lakhiwe lelihlabela ingoma ye-COVID-19 lokuthiwa Eswatini Music Corporation COVID-19 bengithanza kusho bekunene ukuthi lapha emakhaya nihleli khona hlalani bekunene nilalele betempilo uma basitshela ukuthi asigeze tandla singathi menza onye shishiye isikhala sa 1 meter nasebantwini noma edolobheni bekunene kungaba kuhle ukuthi kubani labukela sifo ngoba bekunene siyabhubhisa lesifo asigeze tandla ngesipho singahambeli futhi bekunene asizame ukuthi sonke silalelane sixwayisane ngamunye ngamunye amen.